Good morning, everyone. We still have a few people logging in, so we're going to give them a minute or two to get settled, and then we will get underway. All right, I think we're good to go. Thank you, everyone, for joining us for today's webinar, Supporting Psychological Health and Safety, COVID-19 Workplace Reboot. Before we introduce our speakers, I would just like to cover a few housekeeping topics. You have all joined in on listen-only mode, so you'll be muted throughout the webinar, but we do invite your comments and questions via chat. Please look at the Q&A or chat box on your screen. If you think of a question for the speakers at any point, just type it in there and we will hold it for the discussion portion at the end of the webinar. Note, due to the increase of users on Zoom and other streaming services, to preserve internet bandwidth and ensure we are making the best use of global networks, you may experience intermittent availability of HD video during these Zoom meetings. Thank you, everyone, for taking the time out of your busy schedules today to join us. At this time, I'm going to hand the floor over to Dr. Bill Howatt, who is going to start today's presentation. Dr. Bill, it's all yours.
Thanks, Sydney. Welcome, everybody. It's talking to you today. I'm in Ottawa. It's around 12 o'clock. This conversation, what's going to happen is I'm going to go for probably about an hour and 75 minutes. I'm going to get my head orientated how long this is. And if there's some opportunity for some questions, we'll be able to take some questions, and I can get Sydney to help me with that, with the chat room at the end. So we're going to start this conversation. This conversation is around helping organizations thinking about returning back to work and things they need to start to consider as we start to move towards trying to get some type of re-normal, whatever normal is in our culture, being very, very mindful that we're still in a pandemic. COVID-19 is still there. The virus is still there. It's still not tired. And what we do have is some different things that are going on. We have nice time of year. We have a little bit of apathy when people are getting kind of tired of it. We have some social unrest. We have some psychological reactivity that's happening. We have different crises that are happening, fire season. You'll start seeing storms starting to happen. There's all kinds of challenges for employers to be thinking about as they think about this. And the frame of reference I'm going to be having this conversation with you is from a psychological safety perspective. So it's to give you some ideas to be thinking about, and I will do a little bit of a kind of a background of how I got into this kind of conversation a bit, so you can have some context on how I see this. But be very clear, the purpose of this conversation is to really do two things, is to prevent mental harms and to promote mental health in the understanding inside whether you're in an HR world or an operations world. And lots of you, my understanding is in the HR world. And when I give my background, a little bit about who I am, it might be helpful. So as you look at the agenda, we'll be going actually through four different phases: the impact of COVID on mental health, preparing your organization, considerations for supporting employee mental health, and considerations for supporting people and how we'll do it. Now, my background, as you start to look at this, I'm going to get into a conversation on this topic. One of the challenges I'm finding, this is when I'm starting this, is that lots of folks may or may not have a frame of reference for the difference between mental health and mental illness. Now, as you look at this slide, one of the challenges for many people is being very clear is that I'm going to be talking about from a mental health perspective. And mental illness, when you start to think about what that is in regards to DSM-5 and if you're getting into diagnostic, that's not where this conversation is going to be focused on. This will be focused on prevention. Now, if you think about what's driving people's mental health is very similar to physical health. If I said to you what the algorithm is for physical health, most of you would be able to say exercise, diet, rest, relaxation, lifestyle choices, and sleep. And we know that hydration is something we don't talk enough about, but that's really critical as part of your nutrition. Now, most of us already know this. Whether we do it or not, it's another conversation altogether around values, beliefs, and etc., why people do it. Now we start this conversation around mental health. The big difference between mental health and physical health is really being clear what the algorithm is and understand if you want to have mental health, you need to do it with intention. This conversation, why it's important for observers like yourself, if you look in the screen, you're going to see the environment. Very much similar to the social determinants of health, there's things that the environment can do to actually support. My philosophy is a two-way accountability. There's not enough employers can do to be able to drive mental health for their employees. They can facilitate the opportunity, but employees need to also be able to be understanding what they could do for their own mental health. Now, my background. Some of you may or may not know who I am. I'm the CEO of a company called Howatt HR. We're a strategic HR shop focused on psychological health and safety. I've been in the space of mental health for a long time. One of my PhDs in counseling psychology. I've seen clients for a long, long time. I've done most of my work has been crisis intervention and forensic and addictive disorders, where I did my postdoc at UCLA and taught in the School of Medicine for a year while doing focus on providing physicians insight on how to deal with addictions, the clients that came in. I also worked in Wall Street for 12 years, where I took various roles, of, in a consulting capacity, from a COO role to a CHR role, filling in those. So I am fairly skilled in the areas of strategic HR and mental health. I've also been a chief of staff and a COO. So I've looked at this through a different lens. I've looked at it as a person, as a actually facilitated mental health services, facilitate organizations' operations. Where I think my biggest qualification is I'm a kid that grew up in Halifax for a few years, was adopted, ended up in PEI. My mother and father were bartenders, and for a long time, my mom worked also at Maritime Electric. I recently lost my mom a week and a half ago, which is challenging for even someone like myself, because in this time of this pandemic, it's hitting all of us at different levels. And what the reality is that you're going to have different levels of regret and strain, which I'm going to get into in this conversation. But what's important for you to know about me is I'm the kid that failed grade 2, and I'm the kid that couldn't read or write till they're 18 years old. I'm the kid who lived with a mental health issue his entire life. So I've lived with anxiety, ADHD, and learning disability, auditory and visual. So I take a unique lens on this, and this is why I find these conversations really important, and why I like being part of it, is I want to make sure you have practical tools. Because ultimately, when we're actually helping people, my belief system is mental health right now. If you think what Gretzky's father said, is not, it's not really where the hockey puck is, it's where the hockey puck's going. And what's important for us to be aware of that is that mental health, if you look at Angus Reid, went from around the average Canadian, around 20% had mental health issues. Now it's up to 50% are worried. Mental Health Commission of Canada and Nanos has finished doing a study. You're about 4x times more mental health issue. And I'm coming out with a study with the Conference Board of Canada, where I'm also the chief of research, is that we're leading a study now with the Mental Health Commission of Canada. The results will be coming in the next 2 or 3 weeks. And you're going to start to see the level of concern is incrementally growing. So here's what the real issue is. Mental health right now in Canada, it was a problem before COVID-19, it's only amplified. The World Economic Forum said mental health by 2030 perhaps will be the leading cause of death for premature death. Right now, obesity is right leading the pack. So you start to think about obesity is going up, type 2 diabetes is going up. These types of chronic diseases have a lot of comorbidity with mental health, and you're going to see how people actually cope. Now, why I have these conversations when we start looking at it is as we start to look at the impact of COVID-19, in only 2.5 months, it has had a macadamonious impact on our economy and on our workforce. Now, personally, I've had to deal with suicide. I've had to deal with all kinds of different issues. Some of you, I'm sure, here have seen all the different levels of strain. Essential workers have been under a different level of strain. And what we need to be aware is this is compounded. And what I'm trying to tell employers right now, it's not where we are today. We need to be thinking about where we're going as well. I have no reason to believe that with COVID-19 where it's at, if mental health erosion and we have another wave, we have more social unrest, we have more financial problems, suicide now, issues, more domestic violence in our country, there's more challenges. And what I'm concerned about the most right now is that people's frontal lobe is overactive. There's been all types of adrenaline and people are tired. So the purpose of this conversation with you today is to start to provide some things to be thinking about as your workforce returns to the workplace. And some of them are essential workers were there. So we need to be, so the audience that you have folks that are probably already been in the workplace, especially if you're in healthcare, that have not left. Maybe some administration folks are coming back. Regardless of what the point, where they're at, the purpose of this conversation hopefully will give you some ideas on how to mitigate things that you can start to think about. Now, be clear where we're at in this continuum. If you think about any disaster model, why I keep saying I'm more concerned about where we're going, not where we're at. If you were to point right now in the pandemic, where you think we're at in this disaster model, the Conference Board of Canada with myself, with PSHSA, we just published a blog on this, as well as with the CEO of the Mental Health Commission of Canada. I write a blog with her on a weekly basis that we put through WSPS, and we'll make sure you get those links if you're interested. And what happens is that if you think with the pandemic, we've been under siege, and I don't think everybody quite understands what that really means. Now, human beings are super resilient, and we are able to adapt. But what happens, we become very myopic. We may not be aware of the wear and tear it's taking. Thinking about the single parents at home that are teaching their children, thinking about the challenges of folks. The reality is some people may not actually return back to the workplace, and they might be working from home. May not be in your circumstances, but social connections, the absence of social connections can result in isolation, loneliness, and these micro touches that people have, and this physical distancing and our natural way to interact is having some impact. And where I think we're at right now is, if you think about on the delusionment phase, we're just starting to come down the bottom. You see what are called the bottom, those trigger events? That's what you'll talk about. You'll hear about the second wave, especially in the healthcare sector right now. It's not only the people that have been impacted by the COVID-19 by capturing that disease. Now it's the folks who may not have been able to get the treatment. What's the consequence of those folks? The backlog, people trying to get the backlog caught up and trying to get people just to get their general checkups for the simple little things as blood pressure, for example, and making sure that we don't have people dying prematurely of cardiovascular disease because they didn't get blood work. So there's all types of challenges in our health care system, and I'm sure you know more about it than I do. And what I do know, though, is the fourth wave that's coming when you start to look at this will be mental health issues. I have no reason to believe that if we get through COVID-19 and fully are through it, then we'll need to start to go through the reconstruction phase. So we're still in it. We have work ahead of us. How long? As long as it takes. So with all the different levels of change, some people are actually quite happy that they're at home, and some people may not be. The big point when we get into this conversation, we can't assume that everybody's at the same place. That's the first thing. So when your employees today, right now, the question is where are they at this point in time? If it were returning to the workplace and they have not been in the workplace, again, some may have been in the workplace if they're not, but even the ones that are in the workplace, essential workers with compassion fatigue and burnout, we're seeing some factors, especially when we look at, I was dealing with a call earlier today with folks in senior care and how the impact and the wear and the grind right now and the amount of anxiety, especially where I'm at in Ontario after the military report. And so you start to see that some employees will be excited. They can't wait to get back to the workplace because that's their social connections. And they'll be like the folks that nothing actually quite happened to. Then you're going to have some that are tentative. Is around this whole, what's this new normal going to be? No one can tell you what the new normal is because we're still making it up. And we don't know what the normal was yesterday. It will not be returning back to what's called yesterday. We'll have other provisions, other levels of protocol. Things are going to be different. How different, we don't know. But we can't be Pollyannish about it, because if we start to set false expectations in a time of uncertainty, this is where people can be very, very troubled. Then you're going to have some people who are authentically worried about catching the pathogen, and they may not be able to release the guard. You see lots of people now walking around in this weather without wearing masks. Lots of people are commingling. And I think what happens is, just because the viral load's going down in certain areas, the fact is that until it's remitted, we still actually a spread potential can still happen, because as we know, asymptomatic carriers can be a big problem. It's like a Trojan horse. So we have to always assume that people around us could have the pathogen until we're at a point in time. It's safe, provided with testing is done, and once we get in better information around the antibody testing and some more reliability, and people can be actually clear that I have the antibody and this is what it means. Then you're going to have people that are strained. They might have partners that lost jobs, career, economic. We know with 3 million people who've been displaced during this process, and the food banks where they're at, there's lots of people financially have been stressed. So we have when you have a financial issues, you also have mental health issues. And we have all kinds of people who have been paying attention to family members, as well as domestic violence has gone up approximately 4%. We have, that I know of, is 9 females have been killed in the last 2.5 months because of domestic violence. So what happens is that we do know that it's on upswing for stress. And then traumatized, we got frontline responders. It could be risk for PTSD, different types of things. There could be issues. Operational stress injury is probably a better way to collect this, is because we need to make sure that when people are in their job and they have turn and grind, and where it doesn't always show up to PTSD, sorry, it can show up as addictive disorders, and food is an addictive disorder for some people, whether we talk about it or not. So they're not always drug and alcohol. They also can be process addictions for people, internet, video games, etc. So as we go through this process, we have people are going to be at different levels of change, and what we need to be aware of is we're getting our head on it. So first of all our employees aren't going to be at the same level. So one intervention and one level, we have to be aware that people are going to be in different places. Also, as we're going through any type of change management is just not communicating and sending out an email. Change management is having empathy to be aware that people are going to be at different levels. Now, some people might be shocked, some people might be stuck, some people might see their loss of control. If you see in the bottom where it says emotion, thoughts, and behaviors, depending on where people are during all the different change, even changing policies and protocols now, you're going to see civil liberties where people they're used to what they used to have, what they're used to, their social norms. Some people are going to be pushing back against that. Not everywhere, but some people may. That can create stress in the people who want to be compliant. So as we go through all this, we need to be aware change is not only happening to the work world, it's happening to our society, how we interact, how we actually get groceries, for example. There's all kinds of change, and not knowing when it's going to be end, and the end is important. And the other thing is that people could have, if you think about a stovetop with 4 burners, they could have different issues going on. It could be at different levels of change while they're going through this. So as we start to process how we can move this forward, ultimately different factors will be impacting people and how they'll get through this change. And one of the things is that social connections, we know that compassion, kindness, interaction, people being aware we're educating people and providing them support, coaching, and patience, and all these different things can help move people along the change continuum. It's because ultimately what has to happen is the employers can put in frameworks, employers can put in policies, employers can put in programs. However, something for you to think about really quickly. If I say to you PPE, you've heard that word lots, personal protective equipment, meaning masks and rubber gloves and shields. We have those to create barriers that protect us physically. What we don't talk enough about is what's called PPP, personal psychological protection. The employers that are aware of what's happening, understand what goes on between the 2 ears of a human being is important. Where we know what the capacity is for a machine, we often don't think about what the capacity is for human beings. And human beings are a finite resource. So when they are working harder in the frontal Broca's region with all the change that I'm going through, and they're all at different levels of where they've been impacted by COVID-19, as well as different parts of change, just because someone above the water can be presenting that they're doing really good, you don't know what's going on below the water. And so, for example, I'll just take my case as this. I'm talking to you and I'm presenting, I'm having a really good conversation with you and presenting. But yesterday, my mother, we did a funeral for her and I couldn't be there. And I'm sitting here in Ottawa. My brothers were doing that at PEI. But we just put one step ahead of us. We're all being impacted by this, and we need to be mindful of one thing. Just because you might be doing okay, good for you, we can't hallucinate that's everyone else. And what I mean by that is we need to be aware as we move through this process of change. The model I want to provide you is all about helping to deal with change and build resiliency for folks, again, to reduce mental harms and to promote mental health. As you see this continuum, if you're starting to help people move through it, there's a simple describe, ask, clear up, reinforce. And so one of the things we often don't do in the process of resetting a new norm is describing why we're doing what we're doing, getting people's reactions and what we think about it. This is the wrong time, in my opinion, to be doing all these plans behind the scenes. I think it's important for us to be engaging our frontline folks, getting our key stakeholders involved, educating people, and get people as much as we can in the process, because we're all learning. No one can say they have ever done this before. I mean, unless they were in Mars and they had a pandemic that's impacted the globe. But in modern time, this hasn't happened. With as much digital media and fake media and incongruency and the amount of inaccurate information put out there to accurate information, this is an interesting time. And human beings would, because we have so much technology and so much infrastructure, especially in North America, but what we have to be aware of is the fragility of human beings. So we want to reinforce this, get people moving through it. And this really my role today is not to be spending time talking about change management as much, is to make sure that you're listening and asking, and focusing on problems and implement. And throughout this whole process that I'm about to go through with you, it's because I think too often we do things behind the scenes, create a beautiful PowerPoint, here's the plan, everyone go, versus getting people involved in the conversation. And so consider where your employees are today. I've given you that model. What percentage of your employees do you think are in each one of these buckets? Now, I have a report coming out with PSHSA. We're doing a presentation next week. I think it's sold out. There's around 1,500 people. I'm going to be reporting on some results that I found from a study I did in regards to where people are at in this continuum. I'll give you a hint. They're not all excited. And so the majority of folks right now are worried and are strained. And so right now we have 20% of our populations, less than, is around 18 to 19% of our populations in the excited phase. Our sample size, we did our prospective models around 500,000 employees. So when you start to realize we have a pretty good framework of what's going on across the country in regards to where the readiness of workforce is. And so that concept of worried and strained people are there, and what we need to do is understand there's a good reason. Our fight or flight or threat response is something that's why anxious and worrying and tentative. That's to help us get protected. That's why including people, having conversations, talking with people, this is a time where psychological safe leaders is really, really critical. And what type of programs are we having to support folks? And it's not just reactive. In other words, everybody has internet cognitive behavioral therapy for anxiety. It serves a purpose. We need to be thinking about upstream environmentally what we're doing from a prevention perspective. So what I'm going to do is I'm going to walk through these things. I'm going to walk through reset, risk management, realignment, relearn, and new reality. Just to get you considered, I'm going to go through it pretty quickly. Again, this is maybe from an operations perspective. However, as we go through these elements, it gives you some of the insights of why, when I start to get into what we can do for the employee, what we can do for the organization, and what we can do to support leaders. Again, two lenses I'm looking through: prevent mental harms, promote mental health. But we need to look at the big picture when we have these conversations. So plan. Thinking again, and I'll say it iteratively, we got employees that are in different buckets with all different levels of change. One change you may not have thought about is what % of your employees are going to be going through separations, relationship conflict because of being confined. Now, we do know there's incidents of relationship conflict increases. We'd be pretty naive to think that relationship conflict can't show up in the workplace. Is it the employer's job to fix relationship conflict? No, maybe. Is it? My belief system is to be aware of it and provide folks the infrastructure and the resources to help them. For example, EAP, paramedical, and those type of things. But being aware of the energy drain on our workforce, that's my point. So we start to plan to reset the percentage of employees that will reintegrate to work. Not everybody's going to go back to the workplace somewhere. So some organizations are now making decisions like, like our organization, the Conference Board of Canada, we're talking now about the chance that our workforce will work remotely for the foreseeable future, and we won't be coming to an office. That's good for some, bad for others. Then the percentage of people that'll be working from home, who gets to work from home and why? Staffing, as we start to learn more about who's safe to go to work, who's not safe to work, the questions around, the things that vulnerable workforces, people who have chronic conditions, people with health issues in the workplace, a risk if they get COVID-19. Even with putting the PPEs and putting all those things, there can be exceptions to rules. And healthcare system's a little bit ahead of the general public that's looking at doing this, but it's being mindful around protecting folks. So staffing, human resources, sick time. What are we going to do about sick time? How are we going to cover some? There's proposals about getting 10 sick days so people are all protected. In healthcare, they're probably not as big because they have probably pretty good sick day plans. But being mindful about how we're going to do sick days. If a person comes to work and they have a bit of a sniffle and they have a bit of a temperature, if they go home and they can work remotely from home, does that get counted as a sick day? The other one is around this discrimination. One of the things I can tell you early in COVID-19, certain demographics were picked on, and I had to deal with some different workplace harassment issues. I think it's important in our respectful workplace policy, we ensure that we have provisions around people who are in the workplace, how about being respectful, not being labeling. It is hard enough to be sick, but people being judged. In certain cultures, I know the Asian culture, when in February, I was appalled some of the stuff I was dealing with folks that, who were being picked on. And I think right now with what's happening with our awareness around discrimination and our awareness around implicit bias, we need to be paying more attention and not assuming everyone in the workplace is having the same experience, regardless of our intentions. And that's something that I think we need to do much better about. So inclusion is why it's important, is from a psychological health and safety perspective, it means everybody feeling safe and welcomed in the workplace. And I mean everybody. And we need to stop actually talking about these concepts. We need to actually ensure that they're real. And then making sure around our rules and policies and talking to people. So what if someone doesn't wear a mask? What do we do? And what I'm concerned about is very much like a respectful workplace policy. The mistake that most every organization I see that I work with and provide a lot of consulting to is they actually put in their respectful workplace policy the following. If someone is harassing or bullying, tell the person to stop or report it. Both of those actions have a very, very big assumption. They assume a person has a confidence to self-advocate. And that's one of the challenges why there's so many people underreporting, because they don't have the ability to self-advocate. And we've not put in plans to educate people on what self-advocating is or help people get the micro skills to do that. So when we're thinking about having people being compliant, we need to actually stop this providing people directions and telling people, do this, do this, do this. It makes sense to tell people what we believe will help keep them safe. Then it makes sense to see what are the micro skills we need so people can actually carry those out, a missing step. OHS defined requirements around equipment, PPEs, that's the rules of healthcare, they're pretty good at that. Risk management. Now, we may not have thought about it, but there can be some competency decay of people being away from the workplace. It's interesting, when I saw patients for years and I could, my writing skills, my note taking and how I could do my assessments and all that kind of stuff, because I'm in it all the time. But if I stop doing it for a couple of months, I have to you have to knock off some rust and sharpen my saw. One of the things is that, I'm noticing right now there's a lot more cars coming on the highway and more people are coming. Now I'm also noticing some near accidents and people may not be paying attention. They may not be used to it. My point being is when people go from a place where they were fairly stagnant at home, we need to educate people. Be careful coming to work, especially if they're using equipment or different things. Just at point in time to help people slow down, get yourself back to speed. Human factors such as hazards and be returned to work, just paying attention, talking about risk to reduce risk, deconditioning. Some people that have been sitting around, have been staying at their job, has them standing up a lot. We can't, it's kind of like, I'm an old football coach, you don't actually take someone from zero to over. You need to kind of put them through a process to get them back into game shape, if you will. So think about this helping. How do we help people get into game shape? And so we might want to shorten periods, have a little more breaks, get people's conditioning, make sure we're talking to people. I think sometimes we'll pay attention to our car, how many kilometers it has before it needs a tune-up. And we don't do a really good job with human beings. We just assume they'll go until they break, and then we sometimes will judge them or not. So I think it's being more mindful. Fit for duty. I'm the chair for the CSA Standard of Canada for impairment, the first of its kind that we're releasing globally, and it's out now for public review. And impairment in the workplace is a real issue. Fatigue is a real issue. So in uncertainty, some people may not be sleeping as well. Sleep hygiene is a challenge, and lots of people are still waking up between 3 and 4 in the morning with some hypervigilance because of awareness of challenges and an overactive frontal lobe. And so being aware that around that. The other thing too is some people, I know it may not be in your sphere, but I can tell you that day drinking has increased, alcohol consumption's increased. So some people who've been day drinking without realizing it might have got themselves into some problems, may actually continue some of their behaviors, especially with cannabis and coming to work. So that whole fit for duty impairment, if you're doing a restart with any part of your workforce, ensure that you're bringing those risk management factors back up. So again, distress load, some people could be worried about money, you know, what are called cognitive stochomas, people can be distracted. I think we're going to have lots of marital stress going on, partner stress, job insecurity in some sectors, may not be your sector, but a certain amount of uncertainty. Fatigue has been an issue with this whole new norm. My concern is the frontal lobe's going, and the question is the crisis was inside the crisis. You're starting to see people wondering, just when will this stop? And it's not over yet. Now, the other thing is rushing to try to catch up. You know, like people have been away, and there's this perpetual rush. My coaching is less is more. Let's do a couple things well. Let's get focused. Let's get some success, and let's start getting people back on board. Again, impairment, as I mentioned. So as we start to go through this, the other thing under risk management is psychological impact. That's where I'm going to spend some time today, and that's one of the big ones I'm really interested in from a psychological health and safety is this concept around mental fitness. And I'll spend some time talking about it, and if there's one thing I could have every employer do is really get proactive in mental fitness and what we can do with intention. The thing around work refusal, you're going to have some, maybe not all, but there's some people could develop a real fear and phobia of catching COVID-19. There's actually, there's some literature out now, and some folks have developed a COVID-19 anxiety scale. So some people are almost at a level where there's some hypervigilance. And if you think about germ phobia and people who worry about that, again, it may not be real for you, but you have anxiety is anxiety, and somebody what they get fixated on can be problematic. Perceptions of safety in the workplace. And then the other thing that I'm worried about a little bit is that concept of with tired brains comes fatigue. You might have noticed there's a little bit more irritability. We're doing a lot more in these Zoom things. I'm noticing there's some decay and some social etiquette. People are getting tired because they're hyper-focused, but they don't realize working in this medium actually works even what's called foci vision versus peripheral vision. You have what's called part of your brain, and we have what's called a neural default mode, which means our brains typically wander around 46% of the time. And we are usually in social graces when we're around people. We can kind of move in and out. That's how our brain is trying to process and think. This environment really has people working harder. So if you're in this medium, just if you're a leader in this medium, be mindful that sometimes just an old-fashioned phone call is pretty good, and be mindful of how much time you're actually getting people involved in screen time and work time. Then there's traumatic impact, events outside the realm of normal. There's, you know, dealing with the compound effect. I'm developing an instrument on operational stress injuries in Ontario for first responders, and with including our nurses, we have about 1.2 million in Ontario. And what's fascinating about it is that there's 3 factors that will predict people at risk profile for what's operational stress injuries and being exposure. It's going to be the behaviors that they do, their workplace experience, and the perception of support. So that's going to be important, and we don't, from preventive, spend enough time on this. So upstream, what we can do. Some exposures are going to be domestic violence. I'm really concerned about that. I can't tell you statistically a 4% jump. That is magnanimous, and and being an advocate of that. And what we, in 2020, it still mortifies me with the amount of stuff, workplace violence incidents, potentially patient violence, different things. We need to be aware of what can happen. Then realignment is making sure that what our existing systems, this is a great time to dust off and ensure that our CISM protocols work. Lots of people have critical incident stress. I was trained by Dr. Mitchell and Dr. Everly myself. And one of the things I found from doing CISM over the years, and I've been doing this for nearly 30 years, is ensuring what trauma management early responses you have are actually working, and evaluate your planning. Taking a PDCA, I often find when we do these, implement these crisis intervention, but we don't evaluate their impact and understand, please don't allow this stuff to be check the box. Ensure that you're happy with the people who are facilitating it, and being aware that we're getting people on the right pathways to the right support. We do know from a psychological distress, from psychotraumatology, getting to people early, correctly, with the right trusted infrastructure and with peer support can have a huge from preventing PTSD. There's lots of people in what are caught after 30 days in acute stress disorder that we get to them early, before 6 months before that diagnostic of PTSD or other operational stress injuries, can be helpful. Reinforce substance use policies. I'm just repeating what I'm saying, but again, impairment, I find that often we create policies and we do them once, we don't talk about them. Anything around human capital right now, thinking about whatever thing that people get under stress, because what happens is objective stress, whenever I have a difference between what I want and what I have, and I can't process with my Broca's region, it's almost like I flip a switch and I get caught on my emotive part of my brain. Now, Lather has talked about there's two ways we deal with stress: solution focused or emotional focused. If I feel overwhelmed whenever I have a difference between what I want and what I have, I can go to self-healing behaviors, because human beings are heat-seeking pleasure missiles. We don't like pain. So when they're caught here, they'll get into feel-good behaviors: food, alcohol, drugs, etc. And it doesn't, what you need to understand, it's not just the people who are in Skid Row that are doing this. It's a lot of professionals that are doing this. They're self-medicating to feel better. We need to be mindful. We need to talk about it. Employee support review. I can tell you that I work with all kinds of organizations that have a laundry list about this many different programs they have. And it's almost, and I don't want to sound crass. I know I'm going to sound crass. It's like a badge of honor. I think it's wonderful you're going to do this stuff. But the question is when are folks accessing it? Are they valuing it? What's their wait times? What's the impact? What's the adherence to these programs? I believe we need to get more thoughtful, not only in creating our programs where the people attend. Utilization by itself is a poor metrics. It's a poor metrics. It's an indicator of trend around stigma. Great, people are asking for help. However, I can tell you from seeing patients and someone who's trained all the way to the PhD level in counseling psychology, patients that come in and have an experience in counseling psychology, that will create their frame of counseling or therapy. That will create their frame of reference to how much value they see in it. If they have a poor experience, they may not come back. That's why it's really important that we match expectations. Now, relearn, when we start thinking about this, we're going to have frame of expectations. Again, we now have to, what do we got to relearn? Because clearly things are different today. So is our stakeholders different? Is our training going to be different? The new function that we have, what are the things that are going to be different? Frame expectations. It's perfectly okay. Say we're relearning, we're doing the best we can. We don't have all the answers yet. My sense is that when people are really tired and we have a high digital society, we have a tendency to send so many emails. I don't know how many emails people get. They get all these emails all the time, which, by the way, is never, I don't know if it was ever in your job description, I will read emails 2 hours a day. Somehow that didn't make it to our job description of the function. So in essence, for many of us, it's ad hoc work on top of everything we're doing is processing information. Well, when you're processing important information, you can gamify it. My question to you is, you're doing some training, it's good to do some small mini assessments, not pass or fail, but to get people aware around their confidence, let them do them over again, but get people, be clear what you want people to know, and then have them regurgitate and get them aware of it and help people build it up. social contracts, getting people aware around your expectations, and that's depending on getting people just, my big concern is going to be having people follow these protocols for the long term. And then the last is new realities that work demands, want to stay home. Some people, will want to stay home. Some essential workers will have no choice. Work refusal, making sure managers know how to deal with that, or partners. And this psychological reactivity, we're going to get some of it, people pushing back against the social norms. It's kind of like the speed limit. Everyone believes the speed limit is 100 kilometers because the sign says. But what's the real speed limit? It's about 120. So that tells you through social conformity, the group, the culture will create the norms. So as you're creating a new norm, it's be very careful about what expectations you're set and monitor, because there'll be some stretching of expectations. And we want to kind of get ahead of that. And then the new reality of the, essential versus non-essential. There could be some bringing them back together. There could be some compassion fatigue on the essential workers who might be a little more tired than the non-essential workers, might have some guilt. We need to just be mindful that everybody, allow people that time to integrate and get to kind of heal. The big one I'm telling organizations, if you're going to remuster and bring a bunch of people back, don't hallucinate that as soon as they come back in the first day that everything is fine. Spend that first day just getting through all your rebooting factory, assimilate people, go through your scenarios, take your time. I do believe we really need to breathe a bit and slow things down a bit. Things are moving extremely fast. And as you'll realize as I go through this, in the meat of what I want to talk to you today about is this concept around where the battery is going to be charged. All this operation stuff is going to have a role in folks, but ultimately what your workforce are in those different levels are coming back at different levels, and that's going to impact their charge. I believe, again, mental health goes back and forth on a scale, and what people will do is we need to be aware of it, what they do. And it's really simple. It's what I do as an employee, me, Bill, to charge my battery. And if I don't choose to go to bed early, I'm watching movies till 2 o'clock and getting 3 hours sleep, that can be draining my battery. Then things that the employer could do that can provide support and train and managers of psychologically safe can charge, but not paying attention to work demand or listening or giving employees a voice can be draining them. So if we think about it, what are we doing that's charging employees' batteries and draining the batteries around helping them through this? Because, the reality is, if I showed you that disaster curve, we're predicting the real mental health issues, the major impacts, probably 7, 8, 9, 10 months away. So that's when people are going to start to, it's almost, if you think about people come back from a war syndrome, they come back from war, they're excited, they come home, and then the real stuff happens 3, 6, 9 months. And we know how vets have done. And so when you put people on a great amount of stress for a long time, and COVID-19 is one, that we know that's going to be draining people's batteries. And we can sit back and do as much pep talk, hallucination, and motivational talks as we want. But people who often, because they're fearful of their job, we know the two social determinants that will predict mental health right now is financial security and jobs. So those folks that have employment and finance are probably going to have higher levels of mental health because they're not living in fear as much about how they're going to feed themselves and shelter. And so when you start thinking about those basic needs for 3 million Canadians have been threatened. And so you start to think about the amount of stress that what happens is we want to start looking at, what are we doing that's going to be helping people to drain? So as we go through this process, if we know there's all these drains, a couple quick things to be thinking about as we go through this. If you remember the drains, going back to considerations, is get a baseline. What is your mental fitness baseline of your organization? Now, an engagement survey will not do it because of disintegrated data. If you're just getting what the employee is perceiving, that's not enough. You really want to know, what are the behaviors the employee is doing? What is the behaviors the employees engaging on a daily basis? What are their observations? What are their perceptions around their experience with their employees? What their psychological safety is? What programs are they using? How are they actually showing up in regards to their outputs, productivity, discretionary effort, and presentism, because they're an early indicator for disability. What's their lifestyle choices? So if you think about it, is if we can start getting better data as an HR leader and a senior person and understand what is my mental fitness score of my organization. So from 0 to 100, what is my battery charge? Are we at 75%, 80%? And what are we going to do so that we can actually start to help employees normalize what's going on? Because if there was ever a time to be focused on mental health, it is right now. Stigma is a big issue. I did a study with the Mental Health Commission on the 1 in 5 experience. If you think about the average employee in Canada, who they have safe psychologically to talk to, the median of the research I've looked at is 0, meaning that it's a little bit of, but means around 48% of the population on average has one person to be able to talk to. I mean, there's so many people that don't feel safe. Whether that research was accurate or not, it got me to scratch my head and go, huh. Now, if you think about the average number of relationships the average human being has that are trusted, that they feel safe with, or if they got sick would call them, or if they were in the hospital show up. Lots of human beings. It's when we think about isolation and loneliness, it's the absence of social connections. When we start to normalize this conversation, there's lots of people that are being impacted by COVID-19, but mental health was an issue before COVID-19. So now it's a time when we start to have conversations. We could, organizations, this is a time to have a big impact. I mentioned it earlier, I'm going to mention it again. This top-down hierarchy, we want to get the best out of employees, including the employee's voice. I don't do mental health strategies as much anymore as I do employee experience strategies. Across the employee's life cycle, from the time they're recruited to the time they land, every interaction employee has in the workplace, every interaction could be a positive or a negative that could drain or charge the battery. Mental health is our view of the world. It's not all genetic. Social interaction has a big part of how we actually show up. Civility and respect is important. Incivility is huge. Rudeness, just simple not appreciating the other person's frame of reference. It's not the harassment I'm finding is the biggest issue in organizations. It's misunderstandings, it's rudeness, and it's unresolved conflict. How many people do you know that had a conflict with Mary or Joe or Bob that never deal with that conflict, and that just continues to be an incubator? And modern check-in. So as we're going through this process, one of the considerations for supporting your employees when we go through this is, and then my review is, evaluate both your employees' mental fitness and their perception of psychological safety. If you're doing that now, that's excellent, because now we're 2 months into COVID. We know from all the research I said to you before, mental health is being eroded and being impacted. We need to stop guessing and get what a baseline is, and using, instead of informed-based research, use evidence-based research. So in other words, just participation is not enough. Got to get employees' feedback. One of my beefs with a lot of these surveys is what happens is we get the employees to do a survey and it goes in the pachinko machine. If you ever heard the word, survey fatigue, what that really is they're actually doing surveys without getting evidence that anything ever came out of it. But I can assure you, surveys where employees can see a cause and effect, something happened, they'll be engaged. Most every employee wants to be included. Survey fatigue has to hallucinate that they're not interested in their care. I don't buy that. I think what happens is employees don't know why they're doing these surveys, what's going to come out of the survey, and how it's going to help them directly. And that's really needs to be answered. Organizations, identify what your big drains are. Every organization will be different. And if you ever read the book, Good to Great, if you're not as an HR leader, please read it. And what Collins says in that book is sage advice. Get the brutal facts. Get the brutal facts and focus on those brutal facts. And then consider conducting weekly pulse checks. We find it amazing by being able to give an organization, here's your battery charge, here's your number, what's charging, what's draining your battery, so that we're not having these great big data reams. Give your leadership something easy, less is more, so they can focus on. Normalize. We need to talk about COVID-19. We need to open up, let people chat about it. Everyone's at different levels in that 5 stages. My sense is we also need to be able to provide employees training. Now, manage anxiety is important. And I'm a big fan. I was trained by Dr. Glasser. I'm a big fan of cognitive behavioral therapy. Where I'm concerned about it is because I don't want it to come across we're spending millions of dollars on it, but it is for the people who, sadly, the way we're positioning for depression, anxiety, or insomnia, for the people that are struggling. And the people who are struggling may not actually self-advocate. We know that 2/3, the World Health Forum told, the World Health Organization, too many mnemonics, or acronyms, WHO, their research in 2020 shows that 2/3 of the people with a mental health issue never ask for help. Now, they often don't know why they have a mental health issue. That's why I'm a big proponent on having mental fitness. Having a mental health issue does not mean you have a mental illness. A mental health issue is your current station in life that could be impacting your quality of life, your functionality. Now, if I asked you who Roger Bannister is, most of you would know. The chap who broke the 4-minute mile. Here's something for you to remember. You don't have to be a psychologist to know this. Human beings have what's called a morphogenetic field. And the same thing as Roger Bannister. And no one thought the 4-minute mile could be broken until someone broke it, and then all of a sudden a new norm. Lots of people get caught in their head and have their perceptions, and they have spyware that runs in their head, believe that's where they're at. I believe organizations, by teaching people mental fitness and providing them with the skills upstream from a preventative perspective, can help people get tools before they get down the slippery slope. Very much like physical fitness, we've taught people the tools that they can do. We have forgot to do that in our society. Provide access to online tools. That can be helpful for folks to help them remit, deal with things, as well as coping skills training is really good. Coping skills training is helping people with problem solving. Include the employee's voice. We do a lot of stuff around the employee experience. Quantitative, surveys that can provide some value. One of the things I think really right now can be helpful to creating psychological safe workplaces is trust. Now, one of the things is interesting. We often ask in these engagement surveys, does the employee trust their manager? That's just an okay question. How about ask if employees believe they're trusted by their manager? That's the question we're not asking enough. And starting to create, because integrity and honesty, the byproduct is trust. Lots of employees don't trust who they work with. And if we want to reduce stigma and create psychological safe workplaces, we need to help create an environment where employees can be heard. And so, conducting listening tours where you can do some follow-up, sit with the employees. Sometimes just getting a group of, and ask people how they're doing instead of justifying, just listening, spending more time. We know that the employee experience gap, what the employer thinks is happening, what the employee is, the bigger that gap is, the more problems. What we really want to do when we're creating a psychological safe workplace is to close that gap between expectation and experience. But the more we do that, the better. Civility and respect, social connections is really important, focusing on what we're doing for social connections. Establishing social networks at work and monitoring, that's really important. I'm releasing a study from WSPS, so that did through the Globe and Mail on, might be surprised what the cost difference between an employee with low loneliness to high loneliness is. Employees with high loneliness, their productivity scores are quite a bit different than folks with low loneliness. Now, we don't have a word that's the opposite of loneliness yet, so we just put it on that continuum. Social connections are critical. We're realizing it. It's one of probably the most important things I can think of for helping fuel people, because we have a genetic predisposition to be social connected. Do not assume that people are being compliant. Spend time talking about civility. I find it's a missed opportunity. A lot of management teams leaders just talk about what respect is, talk about how we deal with misunderstanding. Here's a question. If you're a leader, have you ever asked employees how they'd like to be corrected? Have you ever asked employees how they would like to provide you with correction? So what happens is we don't spend enough time. We just assume this stuff around civility will happen. Or how do we disagree with each other? Or how do we say, if you're rude to me, how do I tell you if I think you're rude? Well, we don't have these pre-conversations. So when people feel miffed, some people shut down. Some people get angry. Some people get upset. Some people personalize it. They don't think below the iceberg that person might be not themselves today, and they might be distracted. When you get folks up here with a tired brain, their social behaviors may not be as appropriate. We got to talk about this stuff more to help people, because I believe talking about people is not what we want to talk about. We want to talk about the behaviors and help people overcome those. Monitor differences, getting people around, checking in around. I'm big on, how people feel they're being treated around inclusion. That's important, looking through their frame of reference, how people are accessing programs, how people feel they're connected, making sure that they feel they're being connected. Evaluate your communication channels. Ensure that what you think you're communicating, employees are hearing. Are they reading it? I can't tell you how many people say, well, we sent the emails. Yeah, but when do people have time to read their emails from you? Well, is that just in a pile of another 50 or 60 emails? How do we bring things and illuminate them and make them important? It takes a little bit of creativity, creating briefing notes for managers, open meetings. There's all kinds of different creativity, walking around, talking to all the different employee groups, getting your unions involved, getting a communication strategy is really important. Now, considerations for supporting your people is, your current level of trust, psychological leadership, supporting those at risk, and crisis management. Those are the 4 big ones that we're finding right now. And many times what happens is leaders have not been actually taught any of this stuff. Supporting those at risk, we do what's called duty to inquire. Some people have got that training. If you ask the average manager what duty to inquire is and the relationship to their responsibility and human rights, they may not know. And they have a responsibility. So we start looking at access current levels of trust. If I just slow down for a second, I have to take a minute, and it should be 6. I noticed that we have 2 number 4s, which is kind of no trick. Just read each one of these for a second and give you a break from listening to me to talk, and score yourself on that scale. And the higher you are on this scale, the closer you are to 30, the higher the level you'll probably be respected as someone trusted. I apologize. Just take a second. Now, there's other tools you could have. The purpose of this is to start to get leaders being aware of trust and starting to have conversation. Trust is not just one way, it's 2-way. It takes a long time to build trust, it only takes a few minutes. What we do know, so when employee-manager relationship, if you look at the CSA standard for psychological health and safety, it was created in 2013, you may or may not be familiar with it, that employee relationship is critical, really, really critical to create that place that's a safe spot. Now, if a manager actually doesn't, like people, which we often don't actually ask managers if they like people, we promote people who are subject matter experts, and I'm not trying to be silly. However, it needs to be a criteria that people actually like being with other people, so they'll be more open to want to have interaction and dialogue. The closer your score is to 30, you probably have more positive influence in your team. And what leaders do and do not do will define their impact. And I don't think we're spending near enough time on talking about how to coach trust, honesty, integrity, do what you say, show up, follow through, and include people in conversations. Basic leadership behaviors is really good for mental health. Around a psychological health and safety, my question to you is, how do you create a psychological safe leader? What are the core competencies that you need to have? We have created a competency profile for a psychological safe leader, and what people often think psychological safety, we're talking about bullying, harassment. No, we're not. If you look at the Google research and other research that's out there, it's actually being able, where a psychological safe workplace is where I'm allowed to provide you a point of view. I'm allowed to disagree with you. I'm allowed to share my opinion. That's one of the reasons why I've kept saying over and over and over, engage your employees, because sometimes managers are used to providing all the answers and providing all the solutions. It's a different frame of reference when you start to do it collaboratively and start doing it where everyone's included. And that's the process of creating inclusion so people all feel welcomed and they feel that point of view and they actually matter. See, when human beings feel they have some autonomy and some decision making and they're valued, you care for them, they'll be more likely to tell you in the times when they're having challenges, and they'll be able to feel more safe. But more importantly, it facilitates innovation. When we have people able to use their right brain, they'll have creativity. But if we just want robots on their left brain, that will drive some of that away. Refresh how we support those who are impaired, helping people with impacted by fatigue and mental health issues. What type of support programs do we have? But kind of make sure that your leaders actually know what these support programs are and they actually have firsthand experience and articulate them. There's lots of leaders know what EAP is, they have it, but they may not know all the programming involved. They may also not know the process of how these programs work. So, and they may not actually know how to have safe conversations because they've never been trained in sensitive conversations on how to do that. So one of the things is I think of missed opportunities is having your leaders have lots of insight and awareness. Last one for this frame is, providing this is a skill set that lots of leaders may or may not got, but dealing with grief now, or suicide, we don't talk about enough, in my opinion. How big is the problem with suicide in Canada? Before COVID-19, we had 10 to 12 people take their life every day, about 200 to 250 attempts. To put in perspective, you could take 747, fill it, crash one of those a month. That's about how many people die every month in Canada because of suicides, around 4,000 people a year. That's before COVID-19. You're going to have more people that challenge with suicide. I believe we need to make sure managers have it. We also think we need to talk about it a bit more. I think this is a topic we don't like talking about. Crisis management basics is important to give people crisis management. I also think anger management. People are being very on autopilot, doing the best they can right now. And this is a time where if you're preparing your leaders, you may want to make sure they have these micro skills and they're aware of it. So I'm going to click these out for you. I'll go through the different one. If you're going to do a reboot plan, and this is where you're eventually, when we're doing a free webinar, what we want to do is give lots of things for you to be thinking about. One of the couple things is now to take all the stuff that we've talked about, how do you start to actually put a plan together? Well, one is, what's your employee experience strategy? How are you going to integrate OHS and HR? It's interesting, the OHS have all the plan, do management system backgrounds. Mental health often falls to the HR. If you can get those two working together and put a plan, do, check, act in and measure what you're doing. Human factors, we know if a slippery floor is a risk factor for someone falling and have an accident. We need to be aware of how people's, uncertainty, anxiety, incivility, those things can be levers that we can pull. Focus on reducing harms and promoting health. How do we do that? And not only what we say we do by having a campaign, but what do we know that's actually working? Consider every interaction employees have daily as a positive or a negative. Get the mental health fitness baseline, whatever your instruments you choose. We've created what's called a mental fitness index. I'm sure there's other instruments out there. Because of disintegrated data, we want to integrate our data. And what we want to do is actually move it from simple descriptive statistics to be able to start showing avatars of how people at different levels of charge are behaving, what percentage of our workforce is at risk, so that we can start doing some modeling to see if our program is working. Test one, treatment, test two. I think we need to take a more scientific approach to this and stop guessing. There's a lot of programs, we have little evidence. I'm doing a 3-year action research project right now on what's working in workplaces. Not a lot of evidence anything's really working because we've not put in the metrics of the process. So we do know that, Deloitte came out, they said, looking at a sample of 7 organizations, that over 3 years you can get an ROI. Small sample size. What we need to do is start to get more evidence of what we're doing is working over a period of time. But we do know that focusing on wellness programs over the long term with intention can have an impact. We believe the same with psychological health and safety can as well. Employee mental fitness plans, getting every employee to have their own mental fitness plan, I think is really proactive. Lots of employees are expecting the employer to do everything. That's because of the parent relationship, some organizations. There's not enough money employers can spend to fix this problem of mental health in the workplace. They can facilitate the opportunity. I think they need to become more precision, less is more, do a couple things really, really well, and get evidence what you're doing is protecting people. Put in place psychological safe leaders, I think is really important, a new training framework. I think lots of leaders may or may not understand how to show up to be a psychological safe workplace. And that's something that we want to get more leaders spending time on. How do they become psychological safe? And what are those behaviors, what are those factors? And there's lots of organizations are starting to do it. We've actually created the first that I know of at the University of New Brunswick, a psychological safe leadership certification, which is 3 short courses to give a frame of reference. So it's, it's easy, it's approachable, it gives people a tool. They can do it online on their own and get a frame of reference. And there's others out there, I'm sure, that are thinking about this. Peer support. Peer support's really a proven methodology. It really, really works. The challenge is that doing a peer support program is helpful. The big mistake I find is we don't manage the peer support program and monitor the peer support program. Standing it up and training a bunch of peer support people and letting them go may perhaps not be the best way. It's kind of like mentoring. Lots of people stood up a mentoring program, let it go, but they didn't monitor it and follow through. However, peer support can be really good. Mental health supports, you think about it from prevention to early intervention, what you're doing, and then treatment. I found that most of the mental health for the last few years have trained your managers and duty to inquire for sensitive conversations, have EAP, have paramedical, and they check the box, that's mental health. We got to do better than that. We need to be thinking upstream on prevention, what we can do to actually be curbing these issues so that we can start to get ahead of these. That's really, really critical. And as we start to go through this, I mean, one of the things I wanted to do was to be able to provide some time for questions. And again, this being just kind of an open, free webinar, what we want to do is to give you some time to just open it up for you, and you've listened to me, and I know these types of frameworks are somewhat difficult to listen for a long period of time. So we're at about an hour and 10 minutes. What I'd like to do is open it up for questions. So let's just look what I have here. So, Sydney, are you there?
I'm right here.
Yeah, I pressed stop sharing by mistake. So what do I do?
If you just want to.
I didn't mean to do that. Well, maybe just black screen is fine. Okay, so I got some questions here that I can go through, and then we'll just go, how about we do that? Does that make sense?
Yeah, sounds good.
Oh, there it is.
I was going to say, I think you're just at the end of your slideshow there, so if you just click again.
All right, I'll just go there and just say share. I apologize. I'm learning how to do this tech stuff. It's not sharing now?
You're still sharing. I think you're just on the last piece of your slideshow.
Oh, okay. All right, I apologize. I'll just figure it out here. Oh, there we go. Thanks, Sydney.
No problem.
It's kind of like, it's easy when you know how, isn't it? So let's go through. I got 3 questions here. What approaches can you use to ask staff to complete a mental fitness? Sydney, can you send out the free link to our webinars right now? In that free link of the webinars, there's a free tool there we're putting out place. We're putting the Mental Fitness Index. It's an instrument you can go online, try it for yourself. It's one form of a tool where the employee can complete it. What it does is collects data for the employer, and in real time it gives the employee a simple snapshot of what their mental fitness score is. So, and we also every Tuesday do a free webinar on mental fitness. I'm trying to get people on how to develop a mental fitness plan. We're doing it through CSSE and AMSA, which is, the purpose of that is to give folks the opportunity of, because these things don't have to be complicated. They just need to be intentional, what people can do. How do you get a staff to participate and complete a personal mental health plan? Excellent question. Because there's nothing wrong with them if they start to see stigma. 100%. The big part of it is educating on the why. Simon Sinek, talks about spend time about why mental fitness matters, and understanding that everybody has mental fitness, and just the same as physical fitness. But what happens when we don't pay attention to our physical fitness and we eat too many calories doing exercise, our waist gets bigger. And we can ignore that, but we can kind of get used to it, but our lifestyle choices matter. Well, mental health the same, because our stress level can accumulate. And so we can start to pay attention that if we want to help our mental health, because if you think about the formula for happiness, 50% of it's genetic, 10% of it is environment, and 40% is what we can do. So there's a lot of preventative benefits from educating, and in the stigma piece of it, that we'll be able to help reduce stigma by understanding that we're talking about mental illness. And see, that's a really key. We're not talking about mental illness. However, really important, Key's model is I can have patients with very severe mental illness and still have really, really good mental health. Think about a diabetic, type 2 diabetic, didn't pay attention, got all of a sudden they were type 2. Now to modify, they get themselves in good physical health and take care of their diet, but they still are diabetic. So someone can get depression, get good treatment, go in remission, but have really, really good mental health. But if they let their mental health slip, they're more apt to have a relapse. So great, great question. How or where should organizations start if they don't have these strategies in place, especially if they're tight on time and resource? It's really, really good. Start with a couple of things. I think one of the first things that we can really, really be aware of is getting a baseline. And the reason why we want to get a baseline is so that we can sometimes create the business case for us to slow down. We have all kinds of people that are running around, and what happens is we don't have the evidence of what's the cost of not slowing down and what's the risk. You see, real quick to answer this question, I'd like you to think about a human being and a photocopier. And this is where I try to get people to think about a human being and a photocopier. Where am I going with this? Well, see, to get access to the human being, we pay them. And to get access to the photocopier, we pay them. We provide benefits for the employee to protect them. And we put insurance on the photocopier to protect it. Now here's where to get to your question here. You see, with a photocopier, we're quite willing to pay for the electricity to run the damn thing. But for the human beings, what's the juice? What's the energy? Don't say money, that's access. Don't say benefits, that's insurance. What is the energy? So we actually are depleting our human beings. Then you go to the photocopier and go, we maintenance a damn thing every month, whether it needs or not. With human beings, we have an acute model. We wait till they break. A part of this is there's never going to be a good time. And what we want to do is get a baseline and then create the business case. I wrote an article with Louise Bradley on this. We also provide information on how to create a business case. And you could Google Bill Howatt, Louise Bradley business case. It'll give you a frame of reference in the globe on how to start to create the business case to slow down, really, really slow down. Another question, what if there's no trust between staff and employees? That's really a real issue. In regards to the CSA, what we'll do is they'll spend a lot of time talking, starting at the top, educating senior folks around the importance of mental health, getting them to buy into it. Whoever the champion is, and if it's senior, if you're an HR leader, is to start, and one of the things the standard will talk about is train your senior leaders in mental health, because what happens sadly is lots of people still, mental health sometimes can feel like Charlie Brown, wah, wah, wah. I remember working Wall Street, I was told, hire people that don't break. I mean, the reality is that seeking to understand trust is conversations, and they're difficult conversations, but in a baseline like MFI, for example, and other tools, we get a trust profile and we report. Where I'm going with this is data is king. Getting some data can hopefully start these conversations. Pretty bloody hard when you don't have the senior leaders bought in though. And it takes some time. So your strategy may be helping senior leaders become aware. And I often start real quickly, my question to senior leaders, are you interested if employees trust you? Yes or no, it's binary. They say, yes, What if they don't trust you? Are you interested in knowing that? Getting them asking questions and moving on, but again, it's hard. How do you manage asking for mental fitness information with the desired product? Great question. The good news is health risk assessments has been going around for many years. People use health risk assessments. With all the stuff around CASEL and protection, is part of it is in, just like anything with any applied research, is by working with the unions and working with employees and on your communication, letting people understand about how anonymity is kept, how we only use aggregated data, how they're the only one who have access to the report. And what we have found with different organizations over the years, and I've done this when I was chief of research at Morneau Chappelle as well for 3 years, working with many large organizations, and large health authorities have done tools I've created, is just spending your time up front educating. And you are going to have people that are convinced that somehow the spies, there's that conspiracy theory stuff. That's real. Just don't dismiss it. Slow it down. And provide people. We use, for example, the Tri-Research Council standard section 5, where you need to actually provide evidence to show people how you're actually doing it, provide them consent, provide them permission, provide them with how you do it, and make sure that people know you're protected. How can employees hold their employer accountable to this type of support where they may not be taking these actions? It's interesting. Is a part of it is, and it goes back to one of the things I really like about the standard, is that it's important for organizations, for folks that are in positions of influence. If you're watching this, you're in some position of influence, is to start to look at, when you set the table and you take a long time, you put napkins, forks, they can take a whole, sometimes we think about the end in mind. Sometimes what we might want to do is think about the one or two things just to start getting forward. And one good place with employers is, like Jerry Maguire, show me the money, show me the facts, show people the cost of doing nothing, show people how we can start to hold ourselves more accountable. But being more aware, it's not about right or wrong, it's about maximizing human potential and mitigating risk, and about sustainability. And as we start to look at this, and we start to realize we're going into a level where I believe there's a fragility of human beings that's going to be tested. Just think what happened in the last 3 months. Could you imagine how much erosion and how much impact to our economy or subside? No one planned on this for 3 months. So what if this goes on for another 12 months? So that's what we need to be aware of, is just that whole burn. And then I have one here about, could you speak further in competencies in your area you've spoken of? In my exploration of a number of mastery programs, I've yet to find where these skills must be demonstrated as exit to these programs. I have not seen many HR departments that go beyond contract, pension. What does this do? Okay. So a couple of things I will say to that is just make sure I may or may not be understanding it. One of my PhDs is industrial psychology too, and so competency profiles I've developed, for example, the air traffic controllers of Canada, those type of profiles, fairly elaborate and sophisticated. One of the things I will say to you is that there's some basic primer intrapersonal skills we're not spending enough time. Like, for example, is a psychological safe leader is also taking care of their own mental health. We have lots of people that spend a lot of time paying attention to other people, but they don't take care of themselves. So if you think about, I don't know if you're familiar with Hogan and Hogan's research. However, there's 4 levels of competencies. There's intra, inter, cognitive, and leadership attributes. And one of the things that from a psychological health and safety perspective, if you think there's a tool actually out right now that Marion Bateman and a few of them did, it's a free online tool. And I can find it for you, but I don't have it in hand, where you can go online and do what's a psychological safe leader around integrity and trust, etc. We've taken that competency profile and we've also developed our own. Empathy, for example, it's a skill that can be taught, but many people don't actually know what empathy is. They think they know what it is, but they don't understand what it is modeling. So what I would encourage you to do is, if you're really fascinated on this, It's not so much at a master's level. I don't think you need to do an MBA to get these micro skills for leaders. My sense is that start Googling psychological safe leader competency profiles and competency things, and you'll start to find there's 5 or 6 big ones that are coming out. But you're going to find them. They're under intra and interpersonal skills. So those are the big ones. Now we're about 1:20. I mean, that's for adult learners to sit for as long as you did. That's a pretty long time. And what we want to do is be respectful of your time. So I don't see any other questions. Jennifer, are you there? I don't know if Jennifer's there or not. Okay. All right.
I
Sydney,
am.
You are?
Sorry about that. I was on mute.
So, all right, Jennifer. So do you have anything you want to say to folks to close it up, and we'll call it a day?
No, we will follow up with the recording and any of the articles and stuff that you've referred to on this call. So we will follow up with an email with all of that on it. But if anybody needs anything else, certainly feel free to reach out to me. My email is actually on that last slide that Bill is showing right now. So if anybody has any questions or needs anything further, feel free to reach out, please.
All right. So again, well, thanks for participating. It was just meant to be a conversation and trying to get you folks a couple ideas to think about in a medium, and take a few things, the big 3 things. Focus of I would hopefully more on mental fitness, psychological safe leaders, and measurement, getting good baselines. And if you do a couple things really, really well, I think you'll start to see some impact on preventing mental harms and promoting mental health. So with that, I'll say goodbye. Wish you all the best. Good luck.
Great. Thanks, Dr. Bell.
All right, Sydney, should I log off now?
Yeah, you're golden.
You ended the recording?
Right now.